All right, Dr. Stepovich, more and more apparently, and you tell me whether that's true, more and more adults are reaching for orthodontic treatments, basically putting on braces, instead of the normal grinding down the teeth and putting on a veneer and all that stuff. It seems to be the apprehension of wearing braces as an adult is going away, and also there seem to be rather modern technologies which make wearing the braces as an adult rather invisible and or rather palatable in the first place. Tell us about it. What's going on in that market?
It's certainly true. There's more adults. I'm currently 40% adults. That's over 25 years old. And this is certainly true that patients want to move their teeth instead of doing crowns and implants if possible. And the adult patient that's coming to see an orthodontist is always they know something has to be done for their teeth, and they do come in many times themselves, and then we talk to the dentist. The dentist hasn't sent them in. However, they all have the idea that they need something they'd like to have something done in orthodontic. I guess enough of this has happened in the last few years, and they've heard about adult orthodontics, so the adult orthodontics no longer is something that you don't see going on. Every orthodontist has quite a few orthodontic patients. And I have 40. I may have a few more than others, but there are a lot of adults seeking and having orthodontic treatment.
Okay. Well, has that something to do with that the way of putting on braces became better, or is it just something that people realize, wait a minute, I don't want to ruin my teeth. I don't want to, let's say, pull them out or grind them down with veneers, because eventually they'll break anyway once you do that, and maybe even save some money. Or is it purely that orthodontic became so much better, so much more pleasant to wear that people go for it? Or is it a combination of those two things? What do you think it is? Why people come?
Well, it certainly is a combination of everything. I think Invisalign has driven many adult patients to seek orthodontic care, hoping that they can have the treatment done with Invisalign. However, Invisalign has its limitations, and that has gotten a lot of adult patients into an orthodontic office to see what can be done. And when they find out they can't have it done by Invisalign, aligners without braces, and then they're willing to do the braces because, we do show examples of what can be done, and they're interested, and their interest has been sparked much by Invisalign. So that would be one reason why we have more adult patients. And then there are those patients whose teeth were never aligned when they were younger, and they wanted now to do that because they had the means. Their parents didn't have the means in the time when they were young. And so we have that crowd that comes in also. So, yes, we have more orthodontic patients that are adults for varying reasons.
Well, great. It's probably nice to hear to some of those patients out there those adult patients who are kind of sitting on a fence and wondering whether they look silly wearing braces. I guess that stigma is gone. It's not really true, and so you can save in many cases all your teeth, keep your original teeth, and make them looking good just the way it was intended. I love it, and I'm sure so do many patients out there. Bye-bye, Dr. Stepovich, and thanks.
Thank you.